Hi, I'm Jackie Perryman, and I want to speak to you just a little bit about Malawi. According to the World Health Organization, Malawi is a small country about the size of Pennsylvania. It's located in south-central Africa and has a population of approximately 13 to 14 million people. It is located between Zambia, Tanzania, and Mozambique. It is the fourth poorest country in the world, with an estimated GDP per capita of $667 in 2005. About 80% of the workforce is employed in agriculture. HIV, AIDS, malaria, tuberculosis, maternal and child health problems, and a resurgence of neglected tropical diseases are only a few of the many health problems Malawians face. According to the Britannica Online Encyclopedia, Malawi won their independence on July 6, 1964. But for the next 30 years, Malawi was ruled by Hastings Banda from 1964 until 1994. Banda even declared himself president for life in 1971. But eventually he was defeated in a multi-party presidential election in 1994. And a new constitution was adopted in 1995. The current president, Dr. Bingu wa Mutharika, was elected to his second term in 2009. The Ministry of Health Department is the overall coordinator of health service and healthcare delivery for Malawi. The Secretary of Health is a member of the Malawian President's Cabinet. The Secretary of Health is assisted by an Undersecretary. The Ministry of Health has 6 divisions as listed on the slide. The Ministry of Health provides policy formulation, regulation and enforcement, ensures standards, training, curriculum development, and international representation. The vision of the Ministry of Health is to improve the health status of all Malawians through the provision of effective, efficient, and safe health care. And the mission of the Ministry of Health is to stabilize and improve the health status of Malawians by improving access, quantity, cost-effectiveness, and quality of the essential health plan and related services so as to alleviate the suffering caused by illness and promoting good health, thereby contributing to poverty reduction. The Ministry of Health has 4 central hospitals. These are for complicated illnesses and surgeries. Kamuzu Central Hospital is in the city of Lilongwe, which is located in the capital of Malawi. Queen Elizabeth Central Hospital is in the city of Blantyre, which is located in southern Malawi. Zamba Central Hospital is in the city of Zamba, located north of Blantyre. And Mzuzu Central Hospital is in the city of Mzuzu, located in northern Malawi. In 2004, the Ministry of Health was divided into 28 districts. Each district has a district health officer. The district map is shown on the furthest right side of the slide. The district health officer is responsible for district hospitals and clinics, including their budgets, staffing, and etc. This method of delivering healthcare is called a sector-wide approach, or SWAP. The SWAP arrangement is utilized to improve the effectiveness and efficiency of the healthcare delivery system. It's supposed to be more responsive to the needs of the population in each district. The SWAP arrangement has been established to decentralize health services to the district. Each district, by virtue of geography, urban centers, and economic situation, has different healthcare needs. Because Malawi is a poor nation, services are provided through other organizations. The Ministry of Health provides approximately 60% of health services, and the Christian Health Association of Malawi provides approximately 37% of healthcare services for the people of Malawi. The first central hospital was built in Kamuzu. This is a typical day on the pediatric ward at one of the leading hospitals in Malawi. TB, influenza, and various other patients are all in the same room. At times, two babies are put in the same bed. In Malawi, each patient has a guardian that is responsible for feeding, bathing, obtaining, and administering medications, unless those medications are given by injection to the patient. The guardian is usually a family member. According to the Embassy of the United States, Lilongwe, Malawi, medical facilities in Malawi are rudimentary and do not meet United States standards of medical care. While all health workers have some degree of English proficiency, communication can still be difficult. Medications are not consistently available, or they may not be available at all in Malawi. For any major medical problems, travelers should consider obtaining medical treatment in South Africa, where advanced medical care is available. The EHP is the primary health strategy for the Ministry of Health. The 11 intervention areas address the major causes of morbidity and mortality for the general population. The EHP is a component of the Malawi Poverty Reduction Strategy, with the broad objective of raising the health status of all Malawians. These healthcare interventions will be provided without cost to the population by the government. These strategies were conceived to reduce poverty, increase the efficiency of publicly funded health services, improve equity of access to health services, to serve as a tool for priority setting and the basis for the sector-wide approach, to enhance a shared vision of the health sector in terms of what should be supported with public funds and with external support. The essential health packages try to concentrate scarce resources on interventions which provide the best value for the money. They are a limited list of public health and clinical interventions which will be provided at the primary and secondary level of care. They are intended to be the minimum, but some people will have needs that are not met by the EHP. It is essential to understand the context of an EHP. Some EHPs describe the future, and others are utilized as a short-term planning tool. The program of work is the National Health Plan, which was converted into the Health Sector Strategic Plan in 2007. This plan is supposed to be implemented through the SWAP, or sector-wide approach, because Malawi is in the process of reorganizing their health sector in order to decentralize the health services to go to those district assemblies. This program of work is divided into 6 components or program areas, including human resources, pharmaceutical and medical supplies, essential basic equipment, infrastructure or facilities development, routine operations at service delivery level, and central operations and policies and systems development. Many of the healthcare providers are not nurses, although some are. The primary care providers are responsible for following established routines for providing care to patients, including surgery at times. These primary care providers have little education compared to their responsibilities. These next few slides describe the healthcare situation in Malawi, especially when compared to the United States. Malawi is working to improve the healthcare of their population. The health sector received $62.4 million in donor disbursements during the first quarter of 2009-2010. USAID provided the largest contribution, which accounted for about 34% of the total funding. I did find a quote that I thought was very interesting. It says, "The idea of an old-fashioned model of colonial aid or project-specific, non-governmental organization work based on a donor and recipient model is becoming discredited. One-way aid donation is sometimes not only ineffective, it can have a detrimental effect. In resource-poor countries, one-way aid can encourage dependence, present an opportunity for corruption, replicate systems of inappropriate training, and encourage urbanization of resources and personnel, which leads to the immigration of trained personnel. Some healthcare challenges. The health sector dependence on finances from development partners has been increasing. Most of the country's health infrastructure is old, inadequate for the patient load, dilapidated, and in desperate need of repair and ongoing maintenance. Many health centers lack water and electricity. According to Madonna, Malawi is known as the warm heart of Africa for its people's generous spirit and warm hospitality. Malawians have a rich and vibrant culture. Their love of music is passed down in song and dance from generation to generation. Visiting Westerners never fail to remark on the kindness and resiliency exhibited by Malawians, even in their greatest adversity. In 2008, Christine Gorman spent 3 months in Malawi reporting on the nursing crisis. This article was published in the American Journal of Nursing, and I've put the site underneath this slide so that you can actually go to that site and take a look. This photograph shows hundreds of women and children waiting patiently, except for the occasional temper tantrum, for the mobile clinic to arrive in Emazweni, Malawi. Christine Gorman became interested in Malawi because of the huge nursing shortage. Through the UK's Department for International Development, they have boosted nurses' salaries and nursing school supplements by 50%. While in Malawi, Christine learned this program is working to decrease the number of nurses from leaving the country, or the external brain drain. Another problem has occurred, though, as a result of this program. The country is suffering from an internal brain drain. Nurses are being hired to complete research or to be administrators in the country, and are leaving their frontline healthcare positions of caring for patients. Malawi does have many problems, but the first step to fixing the problem is recognizing that the problem exists. I like the idea of nurses teaching. I feel teaching patients is one of the most important nursing responsibilities. In the United States, we often forget how important this responsibility is because we are busy documenting or caring for the beeping machine. Culturally, differences do exist, and one of those is the respect that is given the nurse. Our culture values nurses, but our society has become so selfish that we find it difficult, if not impossible, to wait in line, even when we know our problem is not as important as the other patient's. I believe it would be more difficult to develop an effective healthcare system for Malawi based on the culture of the country and their healthcare needs than it would be to try to move their healthcare system into the expensive and not always effective healthcare system of wealthier nations, such as the United States. Careful consideration needs to be given to how to deliver effective, high-quality, accessible, reasonably priced healthcare to the citizens of Malawi. The beautiful country of Malawi has much to offer the Western world with regard to how to live with less wealth, pollution, and trivial worries. Thank you very much. This concludes my presentation. I would really like to thank Jessie Wheatley, who is from Malawi, for allowing me to interview her about her native country.